Hey everybody, this is Modern Refugee. When you start doing research on first aid and first aid kits on YouTube prepping channels, you're going to see a lot of videos on trauma kits, IFAKs, blowout kits, these kind of things. And these things are important. It's good to have these things for a variety of different reasons. But there's a lot of smaller things and a lot of things that aren't mentioned as much, fall through the cracks, so to speak. And if there is some type of long-term event, there's a good chance that you might have to look after yourself for a short period of time before you can get actual medical help. The old timers looked after themselves all the time because there's a lot more medical nowadays that's available to people than was 50, 60 years ago. And another thing, too, that's sort of underlying when people talk about this stuff, if there is some type of long-term event, there's a good chance you're going to be doing a lot more manual labor, which opens up other injuries and stuff that could happen. So I wanted to talk about a few of the things that I got set out here on my workbench, some of the things that I've collected over the years and that I've added into my different first aid kits. And the first thing I want to talk about is diagnostic stuff. Now, diagnostic stuff has a lot of benefits. And the first one I'm going to mention here is pulse oximeters. Now, a pulse oximeter became pretty popular in first aid kits a few years back for a specific reason. And being able to measure someone's oxygen level in their blood, that has definite benefits. And I've actually added a second one to my first aid stuff in the last couple of years here. And another thing that goes along with that is blood pressure. I learned a long time ago that blood pressure can indicate a lot of different problems. So I actually have a couple different blood pressure ways to take blood pressure. I have a machine here that I've picked up. And then I also have the old-fashioned manual blood pressure cuff and stethoscope. And a thing that goes along with that is a small notepad and a pen with a manual one, and then on the electronic one, the ability to record those blood pressure readings and pass that information on. I know a lot of old timers that would actually record their blood pressure. They would write that down and then they would pass it on to the doctor when they would go. So the ability to take the blood pressure and know what those blood pressure readings mean, and then, of course, a way to record that information so you can pass that information on. And there's another thing here that I actually learned from my surgery last year. The doctors and nurses told me when somebody has surgery and they're sort of bedridden, like I was, or if they're injured and they're bedridden, it's a good idea to exercise their lungs. And they actually... This was the machine that I used when I was in the hospital to exercise my lungs, because that actually prevents a lot of problems. So I was on a pretty regular schedule where I would have to use this for a certain amount of time to exercise my lungs and keep things moving, basically. Another thing that goes along with, excess manual labor, what might be possible in some type of situation, is injuries to joints and stuff. Mechanical injuries, I guess, is probably the technical name of it. And this gets to something that the old timers always used, but you don't hear about as much anymore, and that's like liniments and stuff like ointments, like your icy hots and that kind of stuff for joints. And joint problems, the older you get, is kind of a thing. And this is actually one that we use here. It's kind of hard to come by. It's a little bit expensive now, but it's actually the best one we have ever used, and it's called Rock Sauce Fire. And it's great on joints if you've done a lot of work and stuff during the day. You got sore backs and whatever. But how many people talk about on YouTube channels about having liniments and stuff in their first aid stuff? But again, it's one of those things. If there's some type of long-term event where there's a lot of manual labor involved, those kind of things are going to become more important, I guess. Another quick couple of things that I'm going to mention here. This is going to, people don't talk about this because I suppose it's embarrassing, but it goes along with the manual labor, and that's hemorrhoids. How many people talk about having some type of hemorrhoid relief or hemorrhoid medication in their first aid kits. You know, there's all kinds of creams and wipes and stuff available now, but if you're doing a lot of manual labor and manual lifting and stuff like that, plus it's something that gets worse with age, those are things that people should have in their first aid kits, because those are your common everyday ailments. Another thing I'm going to quick throw out there too is feminine hygiene. Feminine hygiene stuff is extremely important. Half the population is female, so those things are important. And again, there's whole sections in pharmacies and stuff that have these different products in them, and you should have that kind of stuff. Those kind of things are very, very important. Another thing, getting into like taking care of wounds long term. Like if you had a long term injury that's going to take a while to heal, and you got to change dressings and stuff, you know, things like having extra dressings, extra gauze, that kind of stuff. But then there's also things like wound washes, and I actually have a specific kit that I kind of keep to take care of a wound, like long term, where I have you know, my different wound washes and different ways to clean wounds and stuff like gauze pads, dressings, that kind of stuff. But then I also include in that kit wound wash. And wound wash, see if I can't butcher the active ingredient name here. It's benzocaolium is what it says on here. But these wound washes are important. And there's another one that's called chlorhexidine glutamate. Chlorhexidine glutamate. It goes by the brand name Hibiclines, and that chlorhexidine, there is different applications of that. There's washes, there's wipes, there's creams, there's just different things that where that would be beneficial, and that Hibiclines is pretty readily available. I've seen that in a lot of different pharmacies, so that again, that's something else that I keep in with my first aid stuff. And then there's you know, your different creams and ointments to put on injuries. You know, the ones that most people talk about are sort of like your triple antibiotic ointments, your bacitracins, your triple antibiotic creams. Now there's a difference between creams and ointments. Each one of them has a specific application, and it's good to sort of look that stuff up and see kind of what those different applications are. There's a lot of stuff that is that can be homemade too, and this one right here is a calendula ointment, and you can actually make calendula stuff. Calendula is a flower, and it's a pretty popular ingredient in a lot of home remedies, so you can definitely look that up. But it's you know, that's what the brand name is on this one that I have here. And Silver Cream is another one. Silver Cream used to be fairly reasonable, and now it's become ridiculously expensive. But basically, a silver wound dressing gel has a couple of different specific uses, and again, it's readily available now where you can get that stuff. Another salve is called Ictamol salve. Now, Ictamol salve is I guess what you would know commonly as like a black drawing salve. And again, black drawing salves can be made homemade, but you can also purchase them. There's different brand names and whatnot on them. But a black drawing salve is used to basically draw infections or things like slivers and stuff out of wounds. But that Ictamol name, a lot of people don't really talk about that much. At least I've never heard that particular term used. But if you go ahead and you Google Ictamol salve, you're going to get a bunch of different stuff come up where you can take a look at that stuff for yourself. But just wanted to go over some of these more common, I guess, more common, uncommon things that you don't hear people talk about as much when they start talking about first aid, and sort of the benefits of this stuff, and just some things that I've picked up over the years that are beneficial. But keep those diagnostic things in mind, and keep some of the stuff if you had to tend to stuff long term. It'll be beneficial to you. But anyways, this is Modern Refugee. Appreciate all my subscribers out there. Hope you guys got a little information, a little entertainment out of this video here. Just trying to add some more tools to your guys' toolbox. You have a good one.